Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. The type of local anesthesia that you use and the dosage of anesthesia that you use for treatment in the dental setting is determined on an individual patient basis, much as all of the other things that you have learned so far. The host is an individual, and so our care for each person should be considered individualized. You, the clinician, must view your host in detail and take into consideration that there's lots of information that you obtain during the assessment that individualizes the care that you provide. The safety of using local anesthesia on that patient should be determined. The efficacy of use and whether or not there is a need for consultation with other healthcare providers prior to any implementation of your dental hygiene care plan. These are things that you are going to determine during the assessment phase. In this episode, we're going to discuss some of the considerations that you, the clinician, must review prior to using local anesthesia on your patient, some of the medical considerations, and things that are revealed during the assessment phase of treatment that you should really take a closer look at when you are using local anesthesia as part of your dental hygiene care plan. So that's what we're going to talk about. Are you looking for study sheets? I've created study sheets that cover the content of this episode. If you're interested or that's something that's going to help you on your learning journey, you can click the link listed right in the description of these show notes. Happy studying! Hey, if you're in hygiene school or just got your acceptance letter to hygiene school, I've got a new course to help set you straight right out of the gate when you first start your program to help ensure a successful transition from the first semester to the second semester and to the finish line. I will help you strategize all the key strategies that you need, understand what the challenges are, and overcome all the obstacles. Learning in dental hygiene school is different than any other program. You've got a lot of assessments that are evaluation style. You need to be able to plan and prepare for that and be successful so that you can become an RDH. And I'm here to do that for you. I have a new course, How to Be a Successful Dental Hygiene Student. You can click the link right in the show notes and I'll show you how to get it done. Congratulations on entering this profession. In the last episode, we discussed fear, anxiety, and phobias that are associated with dental care and some of the strategies that you can use to help your patient through the appointment process, even when they present with these challenges. Now, some of these patients are typically more anxious and more fearful when they know that they are going to receive an injection of local anesthesia in order to have the care provided that they're coming in for. One additional bit of information I'd like to add to your knowledge base is to consider how your patient with fear or anxiety presents in the clinical setting. There is oftentimes an increase in our vital signs. Our pulse goes up, the respirations increase, and there's typically elevated blood pressure. You want to be certain that you address some of your patient's concerns prior to continuing with your appointment, because we know that the use of local anesthesia can intensify and magnify your vital signs with the administration of epinephrine. So be sure that you take the time to implement some of those strategies that we discussed in that last episode as you move forward through the appointment. Fear and anxiety can also lower your patient's pain reaction threshold, which is also something we discussed in that last episode. And this can make a patient perceive pain with even a minor or typical non-painful procedure. Some of those clinical signs of anxiety include stiff or abrupt body posture, perhaps some sweating on the forehead or the palms, very nervous conversation. Sometimes your patient will be quick to answer a question that you ask them, or have an over willingness to cooperate because they want to seem like they're keeping it all together. As the clinician, ask yourself, is this patient capable both psychologically and physiologically of tolerating the stress that's involved in the treatment plan that we are planning to do today in a safe way? That is a question you should ask yourself as you're going through the assessment process with your patient. The American Society of Anesthesiologists recommend using the physical classification system before administering local anesthesia and making the determination of which local anesthesia to use. Now, keep in mind that your assessment starts when you meet your patient in the reception area. Remember, you begin with your visual observation of your patient, and you're going to detect at that point through walking your patient back and having light conversation with them if there are any signs of stress or fear or anxiety or something abnormal about your patient and how they present. As part of your health history, you take the vital signs. The blood pressure provides you with an important baseline of your plan that includes the use of local anesthesia. It is also important to keep in mind that if your patient has a reaction or a medical emergency as a result of using local anesthesia, those paramedics that come to the rescue will want to know that baseline blood pressure before you administer the local. There are some guidelines for local anesthesia use with our patients who present with hypertension, and you should know these guidelines and refer to them if you need to when you have a patient with hypertension that you plan on using local to treat. So at first, you may not have these guidelines memorized, and that's okay to make a cheat sheet to reference. It's much better to be safe than sorry. If the blood pressure is greater than 120 over 80, but not more than 160 over 100, there are no contraindications to treat, but you may want to provide a medical referral to have the elevation evaluated. If the blood pressure is greater than 160 over 100, the treatment may be performed but closely monitored, and the medical referral should be issued. If your patient's blood pressure is 180 over 110 or higher, treatment should not be executed, and a medical referral should be given to the patient, and a discussion about your concerns should be also provided. Now, in our clinic, we have specific guidelines because of the type of environment. So these guidelines are different than what we have established in our clinical setting. So you want to be sure that you look at the program manual for those guidelines. Two terms that you want to be familiar with is tachycardia, which is an elevated heart rate, typically greater than about 100 beats per minute. And this can be a warning sign for cardiovascular disease or anxiety for your patient if you don't notice other signs of anxiety. Bradycardia consists of a pulse rate that's less than 60 beats per minute. So you have one extreme and then the other. An additional component of assessment that you may not always consider or think about, but will need to consider when you are using local, is your patient's weight. Weight is an important consideration when we are determining the maximum recommended dose for our patient in order to avoid overdose. And one other thing that I will mention in terms of patient weight when you are calculating maximum recommended dose, if you are administering local on a child and the child indicates that they weigh 125 pounds, just for an example, you as the clinician have to keep in mind that this is not the same as having an adult female or male who weighs 125 pounds. You have to be aware of the liver and other organs in a child who doesn't have the maturity. So, because those organs are not mature, they cannot readily biotransform the anesthetic. So, too large of a dose will place a child at risk for overdose if the age is not considered. For children, you have to consider age first and then the weight when you are determining maximum recommended dose. And this is really important. The health history helps the dental hygienist to determine the type of local anesthesia that is appropriate for the patient treatment. It alerts the hygienist if there is a need for modifications of the care plan or if there is a contraindication for using local anesthesia, or if there's a need for a med consult prior to using local anesthesia. And these are all step-by-step safety precautions that you as the clinician need to consider. Think about the information that's gathered from the patient during that medical history about their past and present conditions. This information includes current medications that your patient is taking. It includes over-the-counter medications, herbal supplements, vitamins, and the use of recreational drugs or tobacco. It's important to determine if your patient has any allergies or systemic conditions. Adverse reactions to local anesthesia in the past, or if there's a family history of adverse reactions to local anesthesia use. This is really important information. Remember, you are a detective when you are doing the health history. If your patient indicates that they are taking a prescription on their medical history, you want to be sure that you know the name of the drug, the classification, and the reason why the patient is taking the medication. Sometimes patients are taking medications and they're called off-label, which means they're not being taken for the intended use that the drug was designed. So this is important. You want to be sure that you know the dose and when the patient takes the medication, because it does matter if they take it in the morning or the evening. And you'll learn much more about drugs when you take pharmacology, but you should always look up the side effects and potential adverse reactions or precautions that you need to take as the clinician when you're providing dental care. Perhaps things like patient positioning, drug interactions, and treatment modifications. These are things that come down to patient safety that you need to look up and understand. Many prescription drugs and other substances can affect the pharmacology of local anesthesia drugs and epinephrine. It's important for you to understand that local anesthesia can also alter the action and metabolism of a number of medications and other substances. So this is a bidirectional consideration for clinicians when they are using or planning to use local anesthesia. As you can imagine, a comprehensive patient assessment is the foundation for safe delivery of local anesthetic drugs. The dental hygiene student must evaluate the patient's physical and psychological state before administering local anesthesia. As a quick review, consider your ASA classifications when you are considering the risk level of patients and everything you learned in medical emergencies. Your ASA 1 patient is a healthy patient. And generally speaking, your ASA 2 patient is a patient with controlled systemic disease. Your ASA 3 patients have severe systemic disease, and your ASA 4 patients are patients with severe systemic disease that is a constant threat to their life. Consider each of these different types of patients and their level of risk around the use of local anesthesia. An example to relate ASA consideration to local anesthesia use is a patient with liver or kidney dysfunction. A patient who presents with these medical conditions are considered in the ASA 3 category typically, and it's a relative contraindication for the use of certain local anesthesias. As a clinician, you have to be able to consider which local to use as well as how much is safe to use. The main focus area during information gathering of your health history with a focus on local anesthesia has a focus on system functions. the nervous system, the cardiovascular system, the respiratory system, the metabolic system, and the kidney function. Think about all that you have learned so far with medical emergencies and risk assessment, and think about how drugs are processed in the body and how these systems need to be considered when you are going to administer a drug into the body. You want to know how these systems are functioning. I will leave you with this. Take all of the necessary steps in each aspect of your assessment to make a judgment call on the safety of using local anesthesia on your patient before you move forward in the treatment. Keep a watchful eye on how your patient presents for their appointment and know the warning signs of a potential adverse reaction or medical complication that would arise with the use of local anesthesia. The wrong anesthesia or the wrong amount of anesthesia. These are all considerations that you as the clinician need to determine. We know that many of the procedures that are done in the dental office require the use of local in order for us to be effective, productive, efficient, and really have optimal outcomes. Patient management is the key to successful treatment outcomes, and we use all that we have learned about communication, the local anesthesia selection, how we administer the local, the techniques that we do, and the strategies that we use to improve our patient experiences in the dental chair. We will be more inclined as clinicians if we use all of these techniques to have good outcomes, the ones we're looking for. Each patient comes to our dental office with their own dental story, and it's really up to us to determine how that story creates the treatment that we provide. We want to create long-lasting, trusting, empathetic, and compassionate relationships with our patients because we want our patients to seek out care and to navigate their own path to health with your support, your care, your knowledge, and your skills. And this is a step in the right direction to helping your patient overcome some of the obstacles that they face that limit their ability to move forward with care. Thanks for listening today. In our next episode, we will be discussing motivational interviewing for the dental hygienist. It's really important to develop the skills of motivational interviewing to really help our patients navigate in a compassionate way through some of the behavior changes that they need to make in order to improve their oral health. I hope you join me for that episode. I would invite you to ask any questions at all that you need answered. Sometimes questions come up when you're listening to this podcast. If you have a question, most likely someone else has the very same question. I'd be happy to answer it and would probably share it in a future podcast.